probably about 20 of them, are highly pathogenic to human and animals. So they cause disease in humans and animals both. Some of them are histotoxic, so they kill the tissues. They are toxic to the tissues. Some are not tissue destructor, but they kill the victims by attachment of toxin to neurons at the synaptic junctions, so they cause paralysis. So two of them you know very well. The first one is tetanus, caused by Clostridium tetani. You know what is it? All of you have been vaccinated against this after the birth, and the mothers also vaccinated before the delivery. This is tetanus. And the second one, which is very important and used as bioterrorist, is Clostridium botulinum, botulism. So these are neurotropic Clostridium. So they show tropism through the neurons. They call it neurotropic Clostridia. These are Clostridium tetani and Clostridium botulinum. Beyond this, we have other Clostridia that kill the cells, tissues, destruction of the tissues. So they disrupt the cells, they destroy the connective tissues, and because of this, they call it histotoxic. They are histotoxic. All of them cause disease by production of toxins. And these toxins are exotoxins. So they are anaerobic. So oxygen is toxic to them. Oxygen kills them. They should preserve themselves from oxygen. Oxygen is sam. You call sam in Arabic?
Yes.
Samum means toxins.
Yeah.
In Farsi they call it zah. I don't know in Arabic you use zah. And in Farsi, one of the top professors of Tehran University translated toxin to zahr and toxin to zahrabe. Zahrabe means liquid toxin or soluble toxin. This is zahrabe. So we have samum, toxins, zahr, and also the other was, which was toxin, zahr, and sam. Okay. Also, there are two different groups of Clostridia in terms of sensitivity to oxygen. One group is very sensitive. Even in a very short time, they are inactivated by oxygens. In a few minutes, they are being killed by oxygen. Some tolerate oxygens for a few minutes, for example, 1 hour or less. So they are not being killed, but you should provide anaerobic condition to them to grow. They stop growing unless you provide them oxygen. They call it the first group, which are very sensitive to oxygen, they call it a strictly obligate anaerobic. obligate anaerobic or strictly obligate anaerobic. The second group that tolerate for a short time to oxygen, they are moderate. They are not very, very sensitive, but you should change the condition to anaerobic condition to let them grow. Otherwise, they do not grow further. So, the majority of anaerobic bacteria in this genus are classified in the moderate group. Moderate group. You get the meat? You understand about differences in physiology of them. What is the importance of knowing this? The importance or the significance of this physiology condition is
to understand how it's grow up, so we can
and
develop, so we can improve. Antibiotic for it.
So you know that they are sensitive to oxygen. You should send them to the laboratory as quickly as possible. So you should preserve them from exposing them to oxygens. Otherwise, false negative results come from the laboratory. The patients have the sickness by this, but the lab say no. Why? Because transferring of the specimen was bad. Delay in transferring of the specimens to the laboratory caused this problem. This is very, very basic data about anaerobic bacteria if you are working as a infectious disease specialist at the hospital to know the differences between the bacteria. Okay, you know Persian very well or not?
Actually, not.
So you want to be a physician? Yes or no?
Yes.
Yes. Where? At Iranian hospital or Arabic hospital?
Iranian?
During the teaching at Iranian or studying at Iranian hospital. When you back home at your countries, Iran, Pakistan, Afghanistan, Afghanistan, many of them, and also India. So, but during your studies and courses, and also at hospitals, when you take history from the patients, you should know Persian very well. So take care about the Persian course here. If somebody is teaching to you, they are empowering you to in a position to get communication with the patients in the future. Otherwise, patient will be reluctant to talk to you. They are always looking for Iranian physicians at the hospital. Students. You should prove yourself to them that you are good Persian speakers, you know very well the people, and you are covered to communicate with the patients.
It's okay, actually we have no problem, but we need your help in this issue.
Okay, because of this, I put you studying Persian here to understand what you are talking. So, بیماری‌های مهم yes. This one.
مثلا نوع انجليزي.
Okay. مباحث اصلی in Arabic, you know, the main topics. Okay. شناخت طبقه بندی و فیزیولوژی کلوستریدیوم means knowing the taxonomy, classification, and physiology of Clostridia. So many of them is non-Iranian words. Physiology, Clostridium, and طبقه بندی is Arabic طبقات, you know. And شناخت, just one word in Farsi. شناخت is knowing. شناخت is knowing. The second one is اصول کلی بیماریزایی کلوستریدیوم ها. Means the principle of pathogenesis of Clostridium. اصول کلی means principles, the principles of pathogenesis بیماریزایی Clostridium ha means plural form of Clostridium. Toxin ha means toxins. سموم. بیماری های ناشی از کلوستریدیوم ها. The disease caused by Clostridia. Epidemiology. You know what is it?
Yeah.
بیماری های ناشی از کلوستریدیوم ها. Epidemiology of disease caused by Clostridia. راه های کنترل means routes of control. routes. درمان treatment. پیشگیری. What is پیشگیری?
Taking more.
Preventive. Prevent. پیشگیری means prevent. These are keywords in tertiary if you are learning medicine.
Yes.
So پیشگیری means what is درمان?
It's treatment.
Treatment.
Okay, very good. So we talk about this thing today in English, not in Persian. But you should know about this as graduate of Tehran University. We are talking about several diseases today. The first one is masmumiyat ghazai. You know what is ghaza?
It's food.
Milk.
Masmumiyat means poisoning. Poisoning.
Food poisoning.
Or intoxication. Poisoning or intoxication. Gas gangrene. What is gas gangrene? You know, we talk about this.
Some sort of gas.
Gangrene without gas. With gas. Gangrene with gas. عفونت های سطحی. عفونت, you know what is it?
Yes.
سطح. سطوح. بافت های نرم. What is بافت های نرم?
No, I mean
Soft.
soft, yeah.
What is kozaz?
Tetanus.
Tetanus. Tetanus is kozaz. Tetanus. And botulism is botulism.
Tetanus, kuzaz, tetanus.
What about this thing? اسهال ناشی از مصرف آنتیبیوتیک. Diarrhea
Is come from antibiotics.
antibiotic associated diarrhea. Antibiotic associated diarrhea. What about colic? Deldak.
Dandart.
Colitis. Colic. Inflammation of colons. نکروز روده با تشکیل قشای تازه. This is necrose. Necrose.
Tissue death.
Okay, we come to this slide. Version reading. بیش از 200 گونه with more than 200 species در محیط‌های آبی و خاکی پراکنده میباشد.
Small amount cause disease. Small amount cause disease.
Okay, it means that the second sentence. The second sentence means they are widespread in the soil and water too in the environment. So the spores of these organisms are everywhere. On the skins, in the small or large intestine, the spores. In water, so, and in the soils. در دستگاه گوارش حیوانات وجود دارند.
And the GIT system of the animals.
Okay, very
Spores
good.
in the GIT system.
The spores are there. And the last one, عامل کشنده در بیماری‌های انسان و حیوانات.
It is a something factor which causes sickness in humans and animals. I don't know what kushande is.
کشنده means fatal.
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 So it's a fatal
Mortality.
Another.
Fatality.
for the humans and animals.
Humans and in animals also they are more important than humans.
Oh.
Now we shift to English language. Just I brought you few slides in Persian. You know what they are.
الحمدلله.
ما درباره بیماری‌های کلستریومی می‌خوایم صحبت کنیم. بیماری‌های ناشی از کلستریوم. کلستریوم‌ها بیش از حدود 200 گونه اسپشیس دارن. 200 گونه. همشون بیماریزان نیستن. بعضی هاشون بیماریزان هستن. همه نیستن بعضیا. اما اونایی که هستن به خاطر تولید توکسین کشنده هستن. می‌کشن. به خاطر تولید توکسین کشنده هستن. پس یه نکته مهم دیگه در تشخیص اینها ما بیشتر دنبال توکسین هستیم. So in diagnosis we need to detect the toxins from clinical specimens. So detection of toxin is important for diagnosis of disease caused by these organisms.
Should we memorize each name, each species, and the human disease it causes?
Not one of them, but a few.
Which few?
Okay.
The yellow one? The yellow highlighted one?
Some of them.
Some of the yellow. So two of them.
زرد
Some of
زرد.
the unhighlighted. Okay. Take care. About the important diseases, first we talk about 4 diseases today. Sometimes they call syndromes, but they are not highly prevalent. But those which are important and concern of the health authorities we discuss. For example, tetanus is very important. So we do vaccination of all populations at the early stage of life. Or tetanus. This is number 1 in my idea.
لا شوفونا ستاند تابتي.
All the infants are vaccinated.
20 دقيقة قصير أعطيك إياها.
When you get accident, sometimes you need to be vaccinated by tetanus vaccines. This slide is on at your book, Moray books. I took it from Moray books. I highlighted 4, but one is highlighted by mistake. The 4th one. So this one. You should replace with this one. This is tetanus. It is very important. We talk about this today. The first one is, according to this book, Clostridium difficile, or Clostrides difficile. Clostrides difficile. Antibiotic associated diarrhea, pseudomembranous colitis. Pseudomembranous colitis is a fatal disease. You should do operation and surgery to remove the affected area of the large intestine. Otherwise, it kills the patients because of these strong toxins. The second one is Clostridium perfringens.
حسنية. ستاند.
You
لا لا.
get to use to talk to each other.
Stand, bro.
No, actually it was one at the stand, so we wanted to film the lecture.
It's important for us.
So this one, we talked about Clostridium botulinum causes botulism. You know what is botulism?
I think botulism, it causes, it paralyzes the nerves and the person stops breathing and asphyxiates, suffocates.
We call it flaccid paralysis. Flaccid paralysis. So the muscle contractions stops inhibited by these drugs. On the other hand, we have a spasm of muscles, constantly spasm in the muscles because by Clostridium tetani. This is Clostridium botulinum and this is tetani. Both cause paralysis. The first one causes flaccid paralysis, the second one causes a spasm of muscles, constant contraction of the muscles. This one, they inhibit the production of acetylcholine, so inhibit the function of acetylcholine. So acetylcholine, you know what is it?
Yeah.
The neuromediators cause muscle contractions. On the other hand, so they work reverse. One is post-laxing and the second one, both of them kill the victims or the patients because of respiratory failure. You know, we have muscles in the respiratory system, so if it is paralyzed, the patient will die. So as a physician, your profession is to help the patients to receive oxygen all the time. You should support the life of the patient by giving oxygen or opening the airways. So, you know, for important we discuss about this, but there are much more. Sometimes we have other Clostridia that cause similar disease, but they are from other species. Yes, we talk about 4 species. What about the first one? The first one is Clostridium perfringens. Spores of this organism are everywhere, including human intestine. This organism grows in the absence of oxygen. It is aerotolerant. We call it aerotolerance because they can tolerate oxygen for a few minutes or a short time. It causes several diseases, including Bacilli, gangrene, and also soft tissues. This organism is rich for production of various toxins, exotoxins. So these toxins are invasins. This is histotoxin. If you read the red line here, you can see the toxins, hemolysins, and extracellular enzymes which are toxins, such as proteases, lipases, collagenase, hyaluronidase. So they cause this histotoxic effect, and they cause beta hemolysis on the they have underscore, but this organism do not show it spore very well. You should provide a special incubation or incubator and also special media to reveal the spore in this organism in Clostridia perfringens. Other Clostridia, they show the spores very well. This is gram-positive organism, so they took the specimens from the wall and see the rod form of Clostridia. Typing of Clostridia perfringens is very important for the neurology of disease. Typing, the classical way is based on toxins. So they call it type A, type B, type C, type E. So the toxins which are produced is different. All of them can produce alpha toxin, but not all of them produce beta toxins. So we use alpha, beta, beta, these the Greek alphabet for explaining of the toxins. So we call it toxinotyping. Toxinotyping is a method of classifications in Clostridium species or genus. So we have type A through type E. Yeah. Food poisoning is the first disease. If somebody take meat, red meat or blue meat, to judge, red meat, what do you call it in Arabic? If it is contaminated with the spore of this organism by cooking and cooling of the meat or the food to impose shock to the spores, so the spore start to vegetate. So if it is vegetated, they are complete cells, bacterial cells. So huge number of bacilli or bacillus Clostridium produced in the meat. If somebody take it in the small intestine, the spore starts to produce toxin. And this toxin is anthrotoxin. And this anthrotoxin causes diarrhea. It is not very serious disease, but causes some disturbance. So, this is anthrotoxins. You can see the size. If you want to recognize the disease, you have two options. Check the lab, or the chart, you call it? Check.
Yeah.
Culture it and count. Take that, count. The number of bacteria in 1 gram of meat or food is important. It has a cutoff. The cutoff is 10 power to 5, 10 power to 5. Saturator, 100,000 in 1 gram. If the number of bacterial cells is more than this number, 100,000, it means that the food is contaminated with Clostridium perfringens, cause diarrhea. On the other hand, you have options to check the stool by food from the disease people, the poison. In such case, the number of organisms should more than 1 million in 1 gram of stool material. So, culturing is not sufficient. You should count the colony stool. Not culture, colony count after culture. Because the spore may be in healthy people too. If you culture the stool from healthy people, you can have Clostridium perfringens. But the numbers is important. How much? How I can count? You can make dilutions and plate on the plate, so you can find out how many bacilli is present in 1 gram of this. So you make dilutions and then culture. In anaerobic conditions, you should know that the generation time of this organism is very short. What is generation time?
Very short.
It means that it can generate or make divisions in less than 8 minutes. Every, not 20 minutes, 8 minutes, they multiply, divide. So, under anaerobic conditions. So, it grows fast in anaerobic conditions. So, the incubation period of the disease is short. with this organism. It's less than 18 hours, 24 hours. So very quick, how is this? Read about the anthrotoxins. This one. This is the sign of the diarrhea. 8 to 16 hours after eating contaminated meat or poultry. The time is important. Sometimes some people take the food and shortly after consumption they show diarrhea. It takes 8 to 16 hours. So for other bacterial toxins, the time may be shorter. For this one, 8 to 16 hours. So we have diarrhea and abdominal pain. This is anthrotoxin. It is a small toxin, it's not large. So it says that trypsins enhances toxin activity. In the small intestine, this organism produces spores. Sporogenesis is accompanied by toxigenesis. So, sporulations cause production of toxins. Where? In the small intestine. In some food poisoning, we take the poison material or toxin with food. In this case, you take the whole bacterial cells and the toxin is produced in the small intestine. In botulism, people poison by having toxin with food in botulism. So it is different. Taking the bacterial cells or taking the toxins. So in Clostridium perfringens, people take the bacilli with food. In botulism, in foodborne botulism, they take toxin with food. Also, in another disease caused by botulism, in infant botulism, the infant take the spore with food and the spores vegetate in the GI tract and then produce toxins. This is different. It is not about these two. This is important to sporulation. Where sporulation happens? In a small intestine. Okay? We talked about this. And for enterotoxins, we have the chance to detect the toxins from fecal material too. We discussed about the culture, but we have another options for diagnosis. This time, we can detect the toxin from the suspected material or the stool. In people who are exposed to these toxins, the immune system produces antibody against toxin. So some people in the community may show positivity or reactions to the toxins. They are exposed to these antigens or these toxins, the body produces antibody. So previous exposure caused the positivity in immune system reactions to these antigens. The enterotoxins act as super antigens. What is super antigens? You have passed immunology?
No.
No, not yet. So write it down and search for this to learn about. What is super antigens? It means that they directly trigger the immune system, killer cells. They don't need antigen presenting cells.
Could you please repeat it? Repeat it.
It means that they directly trigger the immune system. They don't need antigen presenting cells. We have several toxins in bacteria that are super antigens. One of them is these toxins. The other ones are staphylococcus toxins, which we discussed about how we can diagnose the poisoning. This is the cutoff of the number of organisms in the food and also the second disease. This is second disease. Food poisoning is first disease caused by Clostridium perfringens. The second disease is pig bell or enteritis necroticans or necrotizing enteritis. You can find this disease in Murray books and other books. We talk about different toxin types of Clostridia, type A, type B, type C. This is caused by type C. Type C. Type C of this organism produce beta toxin, and beta toxin damage the small intestine. So, look at this. What is it? This is the target of the toxin of this. It causes necrosis of jejunum. Sorry?
What's mean?
Necrosis? Necrosis means damage to the cell, killing the cells, and changes in the appearance of the cell. So in pathology, if you look at the necrosis, you can see differences between live cells and dead body cells. So in pathology, they explain you about necrosis. So it means dead tissues, dead cells. So adjuvant is the target of this organism. Also, it is believed that, or it is proved that some food materials contain antitrypsin agents. It is not in your Murray book, but I tell you from other sources. Some food material contains antitrypsins. And two of them have been mentioned in the book. The first one is sweet potatoes, and it's the first one, and the second one is peanut. You know what is peanut?
Yeah.
Okay. So, people who use sweet potatoes in the regimen in the foods, they got this disease in some. But it is important to know that cases with this disease also have been found in the original country belongs to China. So, necrosis of the small intestine caused by toxins. Toxins, beta toxins. Which type? Type C. Type C. Okay, what is the clinical signs? Here, tell me. Acute abdominal pain, vomiting, bloody diarrhea, ulceration of the small intestine. What is ulceration?
Ulceration?
Ulceration, ulcer.
When we have ulcers on the inside of the body, for example, stomach.
Yes, that's right. Zah. Okay? And also, this one is very important. Perforation of intestinal wall. as a necrosis of the
الأوراق كانت
intestine, and then it leads to peritonitis and shock. You know what is peritonitis?
Peritonitis?
You know what is periton?
Yes.
So inflammation of this as a result of infection.
So it's the infection of the
Yes.
peritoneum?
And inflammation of it.
Yeah.
And the mortality rate in such cases is approach to 50%. So what you should do at your hospitals as a physicians, you order for the operations and then you should do surgery and remove the affected target or the area of necrosis.
All the tissue.
Yes.
We should remove all the tissue, right? Surgically.
The affected part.
Yeah, I mean all the affected part.
Yes. Yes.
The peritoneum you mean? The peritoneum.
Okay, we discussed about the outcome, what happens. For diagnosis of this disease, you should take blood from the patients and search for antibodies produced against toxin. So human body produce antibody against toxins. So you should search for antitoxins in the body. This is the important point. Also, you can do cultures from the periton, for example, from the yes. So culture from blood, peritoneal samples in case of peritonitis, necropsy specimens, and also for searching for antibody against beta toxin. Okay, and the gas gangrene is the third disease of Clostridium perfringens. We talk about food poisoning, we talk about pig bowel disease, we talk about yes, and this one. This one is gas gangrene and related Clostridium bone infections. Why we call it gas gangrene? Because the gases entrapped in the tissues, the dead tissues. If you do palpation on the tissues, you can feel the gas entrapped inside the tissues, dead tissues. And the gas gangrene happens in muscles, for example, not just on the hands or foot or external muscles, but also in the organs in the abdomen, such as intestine and uterines, for example.
Muscles of internal.
Yes. So there are two factors necessary for the growth of Clostridia. Two important points. The first one is, absence of oxygens. The second one is necrotic tissues. So the spores start to grow and vegetate in the absence of oxygens or in the dead tissues, necrotic tissues. And necrotic tissues are depleted from oxygen. Because of this, the organism actively tries to preserve itself from oxygens. This is a mechanism for them to survive and to expand the area of necrosis, to spread their necrosis. How is it possible? Blood is full of oxygens. Red blood cells, they are carrying oxygen. So the organism, the bacteria, try to keep itself safe from the blood. How is it possible? It is a strategy for the organism to cause leukostasis. Leukostasis means stopping the leukocytes to come or migrate towards the focal of infections. So they keep them aside from the necrotic tissue or the place where they are growing. If they do leukostasis, it causes thrombosis inside the veins. What is veins and venous?
Yeah.
Okay. If thrombosis happens in the veins system or circulations, it means that the routes for flowing of the oxygen is closed. In such condition, it's good, very good condition for anaerobic organism to grow. So this is a strategy for them to do. Alpha toxin or beta toxin can do this. You can follow which toxins, write it down. Which toxin causes leukostasis? It may be questions, I don't know. It was. Which toxin causes leukostasis? What is the difference between alpha toxin and beta toxin and theta toxin? They are different. Alpha toxin is phospholipase C or lecitinase. What is lecithin, you know?
Yes.
What is it?
But you think I remember it has something to do with cholesterol, something like that.
It's a form of lipid in cell membrane. If you disrupt this, it means the cell is going to die. Disruption of the cell happens. This is alpha toxin. So you should learn the differences between these toxins: alpha toxin, beta toxin, theta toxin. Utah toxin, which one is lethal toxin? Write it down. What kind of toxins are lethal in Clostridia? 1, 2, or 3. Which one? For example, Utah toxin is one of them. Utah toxin.
What kind of toxin? And
Lethal toxin.
beta toxin?
In Clostridium perfringens. We do have lethal toxin in Bacillus anthracis too, but this is different. Okay, what is this? Maybe divide treated gas ganglion or Bacillian neonecrosis. Another name for gas ganglion is Clostridia neonecrosis. The second form of disease is anaerobic cellulitis and superficial contamination. This one and this one is not malignant. It improves without any amputation, without any resection of the affected organ. But the first one, gas ganglion, you have to do operation to remove the affected finger, foot, or hands. Gas ganglion was #1 killer of the soldiers in the past, before the discovery of penicillin. Many soldiers were killed by sword or by knives or by a bullet, because if you use bullet in the war, it causes the tearing and destruction of the intestine, and in the intestine we have the spores of this organism. On the other hand, the bullet or knives damage the tissues, causing necrosis. Then these spores start to grow.
And the damage tissue.
Yes. If you do cesarean, for example, at the hospital, it may happen by this organism here. Because Clostridium perfringens, if you do surgery at the contaminated area, the spores are there. What it needs to grow is necrotic tissue. And by doing surgery, you damage the tissues. When penicillin was discovered by Flemings, many people survived. Many people got the chance to survive because they were. This organism is still susceptible to penicillin. Look at this one. What is it?
Myogas.
This is gas ganglion.
Gas ganglion.
By Clostridium perfringens. And this one.
All time?
Again, Clostridium perfringens.
Is it like gangrena?
Yes.
It's happen in vein or in tissues, like skin.
Tissues. Other name for this is neonecrosis. Neonecrosis. It means that the muscles also are
So
affected.
the surgeon should cut the leg or like it has. So we should cut the leg.
Yeah.
Leg.
Yeah,
Cuff root.
Cutting that.
So we should cut it, yeah? All of it.
Remove the leg.
Or
Yes.
you need to cut your head.
Not all of them. The surgeon is coming and investigate the tissues. So they have very, very experienced people both in infectious disease and surgery. Sometimes they understand that it is not healable. It's not improved by medication. So they order the surgery.
But I saw one case they heal it.
Okay, it's possible.
It's possible. Sometime.
It means that it is not deeply involved. If it is deeply involved, we should remove the or resection of the affected tissues.
And more, they put a knife, hot knife, in the damaged tissue. A hot knife in the damaged tissue. By that, they will remove the superficial damaged tissues, isn't it? This is the matter.
Yes. Also, you should know that
Burn it.
in some occasions, the anaerobic bacteria grow first.
Ya ne oldu işte?
So the anaerobic organism use up all the oxygens. So the tissue is depleted from oxygen. So it causes anoxia or hypoxia. Then, if the spores of this organism is present in the area, they start to grow. And then they benefit from the anaerobic conditions to increase their numbers. Okay, in this slide you can see again the appearance of the organism. These are a spore-forming organism. You cannot see the spores here, but on the other slides I brought to you from other Clostridia, you can see the spores very well. Look at this. I explained about the
Yaz gene yürüyorum.
lack of oxygenation. In this slide, damage to muscles, impairs blood supply, lack of oxygenation. These are consequences of damage to the tissue. The result of trauma, physical trauma of the muscles. If you damage the muscles, then you stop it from receiving the oxygen. In this slide, you can see other Clostridia involved in gas gangrene, the incubation period. Which one is the shortest one?
First one.
The first one. So these three organisms, Clostridium perfringens, septicum, and lobii, they cause gas gangrene. The last one, lobii, is very, very sensitive to oxygen. Other disease is anaerobic cellulitis. So this is superficial infections. Read it about yourself. I want to talk about alpha toxin. What is alpha toxin? You?
It's the toxin which affects the system and the cell, destroys the lipid membrane and causes cell.
What about other consequence of alpha toxin or other function? Read about the red one.
Hepatic toxicity, which means the liver becomes toxic. Myocardial dysfunction, so someone gets a heart attack, maybe, for example, they said bradycardia, and hypertension.
So alpha toxin also cause disease
In the heart and liver.
Type A Clostridium produce the largest amount of this toxin. it is produced by all types, but type A is the strongest. So differences exist between the strains of Clostridia in terms of production of different toxins. About beta toxin, what is beta toxin? We discussed there. Febrile disease.
Yes.
Okay. What is it?
White sauce.
This is directed for me.
No.
You mentioned of the nucleotic lessons and the proliferations to nucleotides enteritis.
Yeah. We talk about febrile disease.
Yes.
So this is not telling you what is the function of beta toxin. What about epsilon toxin?
Epsilon.
Cause that increases the vascular permeability of gastrointestinal wall, so I think there should cause edema or something.
So this is activated by trypsin. Yes? But beta toxin
Beta toxin
is produced when somebody is taking antitrypsin material. This is different. So one toxin is activated, one toxin is blocked. Eutatoxin, we talk about lethal toxin. Which type is producing this?
type P.
Type E. Not all of them produce eutatoxin. Clostridium perfringens and Clostridium botulinum are microorganisms that are used for production of biological weapons, for masking of the people, and also by bioterrorism. So, what is the activity of eutatoxin?
Increase vascular permeability.
Okay, necrotic activity and increase vascular permeability. Okay, you can have break for 5 minutes. You can continue if you like.